Hello, hello, hello. Hi, I'm Dr. Vita. I help women that are having hormonal issues and that are struggling to conceive, regulate and balance their hormones, and also conceive and get that beautiful baby that they want. So, this week I have been focusing all of my discussions on autoimmune. Even for those that don't think they have autoimmune and they're trying to conceive, I wanted to discuss a few things with you. A lot of autoimmune issues go undiagnosed. So you may say, like, I don't have lupus, I don't have MS, um, but if your immune system is attacking any of your organs, then you have an autoimmune disorder. So if you have noticed that, like, your AMH levels are low, so you have a low ovarian reserve, you have a low number of eggs, then that could be due to autoimmune. So just because you haven't been diagnosed with autoimmune doesn't mean that you don't have it. For example, somebody could be walking around with HIV that's undiagnosed. So just because they haven't been diagnosed with it, it doesn't mean that they don't have HIV. And then there are a lot of instances where we want to diagnose people with an autoimmune, but we just don't know if autoimmunity is what cause that particular issue. So there are different stages in disease. Um, there are stages in which it's early and your immune system is just being hyperactivated. So let's say we're talking about premature ovarian failure. So these are my women who have low AMH, they just have a couple follicles, but they're young. They're not at menopausal age, or maybe they're 41, 42, they're in their early 40s. Um, and so you'll start to see, these lower AMH levels. And then it keeps progressing and progressing and progressing until they have no eggs. But a lot of times we don't diagnose a particular autoimmune when their AMH is, around one or on the lower end. So I just wanted to get on here and just talk about misconceptions and just encourage people to think outside of the box. Women that have been trying to get pregnant or women that want to get pregnant but have some of these low numbers in their blood work, or women that want to get pregnant but you have diabetes. So that's autoimmune. Or if you have endometriosis is autoimmune. So there are these like full blown stages, but then you also have the woman that doesn't have endometriosis, but her lining has extra tissue, but it's not at the stage where it's endometriosis. That is an indication of autoimmune. And so people underestimate how important it is to pay attention to the immune system. So if you've been struggling to conceive and if you've been trying for a long time, this could be the reason why. Your immune system, you're probably having autoimmunity. And not just autoimmunity that's leading to low eggs and premature ovarian failure, but you could also be having autoimmunity, your thyroid, other organs of your body. There are over 100 different types of autoimmune disorders. So you could have one of those and you just don't know. In medicine, there's some issues that happen that we don't diagnose everything. We can't diagnose every single thing. I always like to say there was a point in my life where I got super sick and there was no explanation. Sometimes people have unexplained infertility issues, and they don't know what's wrong. But this could be something that's an indication. This autoimmunity could be an indication that something is causing your immune system to attack itself. Are autoimmune diseases preventable? Yes, some of them are. We're starting to see a rise in the number of autoimmune disorders, particularly in women. And so we're seeing this rise. You have to think about what could be causing more women to have an immune system that is targeting them. Well, a number of different reasons. Number one, I'm the toxin queen, okay? What activates the immune system are hormones. Hormone. And so you have a hormone that triggers the development of your immune cells, a hormone that triggers your immune cells maturing, your immune cells targeting your your tissues. So a lot of times I see autoimmune issues, unexplained infertility issues kind of reduced, kind of toned down when we pay attention to those hormones. And what I found is my women with full blown autoimmune, actually, let me tell you this. None of the women that I work with were diagnosed with autoimmune, but more than half of them actually have autoimmune that went undiagnosed. So I'm looking for that. Whenever I work with someone, I'm looking for that. And by the way, my services are all virtual, especially right now with COVID. I'm not touching anyone. Even the lab testing that I do lab testing in the United States, Canada, Ireland, UK, some other places in Europe. The lab that I work with will ship a kit. I will teach you how to draw just a tiny amount of blood and then ship it back. And then we have the results in a couple of days. So all of my work is virtual. I'm either here or I'm in my lab. That's it. I'm not touching anyone. I'm not going to anyone's house. I'm not in anyone's doctor's office. And so virtually, I'm able to meet and be able to say, okay, this person has an autoimmune disorder that's causing them to have unexplained fertility. Sometimes it doesn't come up on a blood test. Sometimes it's not going to come up on a blood test. It takes someone spending an hour with you to figure out if you have an autoimmune. It takes someone getting an extensive history, not only blood work. Sometimes I don't even need blood work to tell, but a lot of times I'll order blood work and then we'll look at the blood work combined with an extensive history of how are you feeling. Um, Tell me whenever you eat this, how do you feel? There's some women who have autoimmune diseases that are preventing them from getting pregnant because they can't digest gluten. They don't even know. They don't even know that eating wheat is what's preventing them from getting pregnant. Some people will eat gluten. Some people will have, let's say, toast, and then it stimulates an autoimmune reaction. And then they're in trouble. And so if they're reacting to that wheat, every time they eat that wheat, it's affecting their fertility issues. That's just one example. There are numerous of them. So it really takes weeding out and really looking to see what is the health state of this person? What's affecting this person? When you wake up in the morning, how do you feel? When you eat XYZ, how do you feel? When when you drink XYZ, how do you feel? When you're on your cycle, how do you feel? So I am doing a workshop tomorrow that I think women that are having fertility issues, and I consider fertility issues somebody who's been trying for more than a few months. For me, if you've been trying for more than 3 months, then I would consider you as someone who should probably get some help to change a few things. I'm not going to diagnose you with infertility if you've been trying for 3 months, but I do take it seriously if somebody's been trying for 3 months. And I want to close with this, that you shouldn't have to cry to get pregnant. That's my motto. You should just get pregnant. So whenever I have women that have autoimmune that come in, we find that in the process of trying to correct that autoimmune, that they just get pregnant. And a lot of them have actually given up on the idea of getting pregnant. They just want to get healthy. And so within that process of regulating, we're not only regulating autoimmune, we're balancing your hormones, we're getting you to a healthy state. We see that the women get pregnant. How is that? And so it's a dark place to not know what's causing what's causing the delay in conception. And so I'm having this workshop tomorrow on Thursday, January the 28th. It's 2 p.m. Eastern Standard Time. And this is when I'm going to sit down for a good 20 to 30 minutes. We're going to go through a PowerPoint slide. I'm going to have kind of a list of things that I'm going to say, do you have this? Do you have this? That way you can know if you have an autoimmune. So I've put the link in the description for you to join me for that. It's important because I'm going to stress this enough. A lot of autoimmune disorders go undiagnosed. A lot of women that are struggling to conceive, it's autoimmune. Your hormones are being attacked by your immune system. Your hormone producing organs are being attacked by your immune system. especially if you've been diagnosed with endometriosis and things like that. They say that there's no cure for endometriosis. Those conditions absolutely can be managed. It just takes somebody working one on one with you. A lot of people's doctors don't have time to spend an hour or more per week or every other week or even once a month or even once a year. A lot of doctors just don't have that kind of time. That's just the way that things are laid out. There's just not that much time. And so it really takes working one on one with someone to say, oh, okay, maybe I do have an autoimmune. Maybe I am going towards the endometriosis route. Maybe during my period, I like release blood clots. So maybe those blood clots that I'm releasing, that's an autoimmune reaction. That's, XYZ. It could be a number of different things that are causing it. If you have an autoimmune disorder diagnosed and it's being treated and under control, could it still cause problems even though it is controlled? I would need to know which autoimmune. So the software that I'm using, it doesn't tell me who's commenting. So it just says Facebook user. So I don't know exactly who this is and if I've talked to you before. So it depends on the autoimmune disorder. So for example, endometriosis. Let's talk about endometriosis. If someone is being treated and under control, you mean that there's a reduction of tissue. Is there still tissue? Okay. If there is still tissue there in the case of endometriosis, then it will still cause problems. Oh, Graves' disease and endometriosis. Okay, that's a whole nother thing. If people have multiple autoimmune disorders, then we need to figure out a root cause. In those types of situations, I say treatment, giving somebody pills for it, is just a band-aid. Okay, so if I burn myself and I'm just putting a band-aid on here, but I'm not actually healing the wound from within, then I'm just covering it up with a band-aid. It's never going to go away. I'm just putting band-aids on here. So what makes it go away isn't the band-aid. It's actually working on it from within. So my tissues in my body have to go in there and heal. So for people that are having multiple issues, so I actually know someone that had Graves' disease, endometriosis, and they had low ovarian count. For somebody like that, you have to start from ground base zero. There is something in that person's body that is causing them to have autoimmune issues everywhere. So if you have more than one autoimmune, then you need to go down to ground zero. So yes, you will have problems because those are two that are diagnosed. There's some that are undiagnosed. So you can talk to me for a little bit more information on that. But my answer to you is if you have multiple autoimmune issues, it's a sign that there are serious issues going on in your body that can be worked on. Absolutely. There's no such thing as, you will just always have them and there'll always be an issue. But if your treatment is just putting a band-aid on the issue, then no, you will always have issues, especially if you're trying to conceive. Feel free to inbox me for a little bit more information. I would like to know more about when you were diagnosed with some of these things and your situation, what you mean by treated. If it's a band-aid on top, then you will always have issues if you're just covering it up with a band-aid and not actually figuring out the root cause. We have another question. I am planning to have a baby. How best can I prepare myself? Are you a male or a female? I think you're a male. So for males, I think it's always good to first go in and get blood work done. So you can contact me, my lab can send you a kit, or you can go to your regular physician. I know right now it's a little tricky pertaining to COVID-19, but if you are planning to have a baby and you're male, it seems like this is from a male, number one, go get blood work done. Just get a regular physical workup. So after you get your physical done, then that'll let you know, like, okay, my metabolic panel is normal or my metabolic is not normal. If you see that there's an issue there, and let's say you have a low potassium, or let's say you're missing minerals, then now it's an action plan of trying to incorporate foods and natural substances that have that particular mineral or vitamin in it. Then I always suggest, after people kind of have an idea of their blood work, is I always tell people to go undergo some kind of detoxification process. So if you undergo some kind of detoxification process, you are restoring and replenishing your liver. So the liver is the one that controls all hormonal activity. Getting pregnant, trying to conceive, holding a baby, all of that is hormonal. Your hormones, your LH, when you pee on the stick, that's a hormone. HCG is the hormone that's released whenever you're pregnant. That's everything's, your hormones are carrying you all throughout your pregnancy. When you're in labor, those are hormones that are released to go into labor. When you're nursing your baby, those are hormones that are released when you're nursing the baby. Everything's a hormonal reaction. So I always suggest some people go through some kind of fertility boosting detoxification so that you're not harming your fertility. You're still maintaining fertility. So detoxification is next, so that you can restore, replenish your hormones. And if you're healthy, then after your detoxification process, it's time to now incorporate some nourishing herbs into your routine that will ensure that you get pregnant. So that's how you can do it. Um, this is standard for male and female. But for males, I highly suggest you undergo the detoxification process, and there are herbs as well to help men's sperm motility and count be optimized. Okay. So if you want to join me tomorrow for our autoimmune workshop, I think this is highly important. If you're having any kind of health issues, really, autoimmunity is an area that you should take a look at. But if you're trying to get pregnant, this is going to be a good workshop for you. So join me there, bring a pen and a piece of paper. I'll have a list of symptoms for you to check out, and then I'll have an action plan for you to actually take steps. This is completely free. So join me for that. Okay. Thank you all for joining me. If I can be of any support to you, always write me. I'm always available for a quick chat as my schedule allows. But there's nothing wrong with at least sending me a message, and then I can respond. All right, everyone. Have a wonderful day. With love.